You that you do overlook cough. You cough, and the cough is lasting for a week, 2 weeks, 3 weeks, 4 weeks. Abba. You should understand that once you start coughing, there is something wrong somewhere. There is an inflammation somewhere. And if you continue to sit back and you look at it without consulting your health practitioner for proper management and treatment, do you know it can migrate and aggravate to chronic disease? Do you know? And if the cause of that cough is not tackled, it can lead to COPD. For example, look at someone smoking. Beginning of a smoker, it won't be so serious. The cough would not be there. Maybe from the beginner, the person will cough fine because it's just introducing the smoke into the system. But as time goes on, you get used to it. No coughing, nothing. He's enjoying it. But it will get to a point that the cough will start coming back constantly. The individual, the smoker, will be coughing seriously. That any kind of smoke he or she inhales will aggravate cough. And if that individual keeps to himself, not going for any checkup to find out what is happening or what is going on, to seek help, to seek, medical advice and medical intervention, COPD is close to that person. It now gets to the point of the person coughing out blood in the sputum. You see blood in the sputum. You see unclear particles. COPD is knocking. Why don't you now stop the smoking? Why do you not have to go into the smoking in the first place? Why? Why? Why did you not start the smoking? Why did you start it? See, all these habits. All these habits are not good for the health. They are bad. They are bad habits. So why do we indulge ourselves in it? It doesn't add value to you. It doesn't add value to your health. It doesn't bring more money. In fact, it makes you spend more. You spend more of your money to get them, to use them, and to even you not carry disease on top of banner. Why not help yourself? Help yourself. Help yourself, help your family, help your relative. Because when it start happening, when the chronic disease will set in, it is bouncing on your relatives and your families. And it's not just any other family. The ones close to you, the ones you feel you love, are the ones that will now suffer it. And you claim to love them. That is not love. That is not love. Now you are being told to stop. Now you are being told not to go into it. You feel they don't want you to enjoy life. There are other ways for you to enjoy your life. So please don't attract COPD into your life. It is a chronic disease. And the person can even have heart disease on the long run, at the long run. So, Gilambaka, what are we now saying? Stop it. If you are coughing and the cough is getting to a week, go and see your doctor. Don't do self-medication. Go and see your doctor. Your health practitioner is there. Go and see them. Not that you will say it's typhoid, it's malaria, it's this, is that. No, there are some histories the medical practitioners will take from you that would point out what really went wrong, not assumption. And there's a medical test you would do that you will carry out that would show what is really going on and the proper medications to use. So please, I beg of you, stay fit, stay healthy. Follow us on every of our channels, on every of our social media handles, on Twitter, Facebook, Instagram, TikTok, YouTube, everywhere you see that is social media handle. We are there at OOCDPHI, at OOCDPHI, and from Olujide Oyelade Business Preventive Health Initiative. I tell you again, stay fit and stay healthy. The same way there are rules, regulations, laws binding a nation or a country, is the same way there are rules, regulations, and laws binding your health. You see that saga, the recent saga that is happening, that is trending now, between Mr. V and Mr. J. You understand what I'm saying? That one, gang. Yes, that one. There are laws binding what happened between them, so they don't have excuse. They don't have excuse to what they did on the airplane in the presence of all those passengers. You don't have excuse. Likewise, you don't have excuse why you should not take care of your health. Why you don't know your BP, your sugar level. You don't have excuse. You don't have excuse. Imagine an individual that is ill or sick, went to the hospital, and the BP was checked. It was reading something high, and they ask you, what's your normal? What does your BP normally read? I don't know what you used to read, or they ask you, what's your sugar level? What's the reading of your sugar level? I don't know. I don't used to know. You don't, because you don't used to do it. Because you don't check, you don't do it. You don't. Oh yeah. Stand up from that place now. This is the second time I'll be telling you. It is very important you know your sugar level. It is very important you know your blood pressure. It is very important you know all these vital signs. Some don't even know their weight. Maybe they are adding weight or they are losing weight. They don't know. They don't know if they are getting obese or they are getting slim like a toothpick. They don't know. Why is it like that? Why? Some don't know if they are getting taller or shorter. They don't. It should not be like that. It should not be like that. Always know these are called vital signs. They are vital signs. They are important to your health. Before the medication will be prescribed to you in the hospital, if you have not checked your BP, your blood, your weight or height, your sugar level, the medication will not be prescribed to you. So you need to know. Follow us on every of our social media handles: Facebook, Instagram, Twitter, TikTok, YouTube, on at OOCDPHI. OOCDPHI. I say to you, know your numbers, know your sugar level. from Olugide Oyelade, Chronic Disease Preventive Health Initiative. We say stay fit and stay healthy.